Hey everybody, in this video I'm going to talk about different conditions that come from neck nerve pain, specifically one called Thoracic Outlet Syndrome. Now you may not have heard of this one yet, but you may be feeling the effects of this one. I'm going to show you how to do a massage on it and then what some of the symptoms feel like when somebody has this. Coming right up. Thoracic outlet syndrome is really similar to sciatica, which they both deal with the nerves, and they're both kind of this overreaching definition of nerve pain that comes from a specific area and affects multiple areas down the line. The nerve can be pinched anywhere along the way with fascial adhesions or just tight muscles, and it can cause pain anywhere along the way. And I feel like it's another one that gets overdiagnosed as a neck problem or herniated disc or bulging disc. And I've found that a lot of times it can be alleviated by focusing on certain spots in the body, and I'm gonna show you what those are in the massage. Okay, what do the symptoms feel like for this particular condition? A lot of people talk about having numb fingers, especially these 3 fingers right here, and especially when you wake up in the morning. Also, if you feel like a burning, aching pain right here in the traps, somewhere around here, and also it can extend back into the lower traps, this may be part of your problem. If the problem gets worse, if your arms are up all day, that could be another sign. And then if the pain gets worse when you're laying all the way back without a pillow, that could be another indicator that you might be experiencing this type of problem. Now I know a lot of us can't go get a massage right now, so make sure you follow me on Instagram. I'm gonna post a tutorial on things that you can do at home on yourself to help alleviate this condition. Otherwise, let's watch the massage and get started. Now the majority of the problem areas are located in the front, so I usually start in the supine position. Now a lot of times in more severe cases, they may not be able to handle this neck position, so I like to massage here first, and then I'll add a pillow. This will get better with more massages. Now when I do my warm-up, I'm going to spend some time warming up the traps. Remember that the pain is often felt here, but it's not typically the problem. Also, what I'm doing here is checking around the vertebrae for inflammation and investigating muscles that might be extremely tight and are pulling the discs out of alignment. This can be one of the causes of nerve pain. A lot of times after muscles are relaxed and fascia gets stretched out, they get a free, unintentional adjustment as the discs relax. I do a good amount of passive and active release to help assist the relaxation, and I spend some time stretching the fascia. This involves pinning areas of the neck and then allowing the head to drop away and stretching out that fascial line. By pulling the trap away from the other neck muscles, this can immediately reduce that nerve pain, and you may need to return to it throughout the massage. While I'm targeting the upper traps, this is most likely going to be welcomed immensely. We definitely have to be patient because neck muscles are notorious for being especially strung up and tight, and it takes time to relax enough to stretch. Now here's where we get to the most important part of the massage. The scalenes can be solely responsible for causing the nerve pain, and I approach them a couple different ways. There are 4 scalenes, and we are going to focus the most on the anterior scalene. Now I rarely use my thumb to massage, but sometimes I will use it to strip these muscles. You can also use your fingers to do the same thing. Then I will search for areas that feel thicker. These may be the overly tight areas responsible for nerve impingement. Now to get to the anterior scalene, you need to nudge the SCM out of the way and go underneath it. Turning the head will also leave it more exposed. Make sure to go all the way to the front of the neck, down the SCM, all the way to the collarbone, and stretch the head over. This is going to be very important. The second most important part will be right here on the chest, specifically right under the collarbone. If we review the pain pattern, we're going to see that tight fascia and muscles can be clamped down on that nerve. I will spend some time warming the chest muscles across the body. I really love approaching it in this direction and slowly start palpating deeper. A good majority of people with this problem will have forward rotation of the shoulders from either computer work or poor posture or even depression or all of the above. When we suffer from depression, we unintentionally curl into that fetal position, and that includes that forward slump in the shoulders. Now, to really help open this up, I will press up and under the collarbone while using passive release. There are a lot of techniques in relaxing massages that are beautiful to watch, but this type of work is very slow, methodical, and meditative. Now remember, you are working right on top of the nerve bundle. If it is already inflamed, this can aggravate it more. But again, the work needs to be done for this to heal, but it's just good to keep that in mind for somebody that is having severe pain here. Opening up the chest even more, we now stretch open the fascia line to the chest. Pec minor is another muscle that can be pinning that nerve bundle, so I'll use some release here to loosen that up. You can also just pin it and allow them to do the action for you. This is a highly effective method to release this muscle. I cannot overstress how much the chest and shoulder needs to be open for this condition to finally be relieved. In order to do that, you need to target pec minor and the traps and the lats. Now, I do like to use gua sha to aid in releasing fascial adhesions here, but it's generally not used until a third or fourth visit. It can greatly aggravate an already inflamed nerve, but it's also amazing at helping all of this heal for good. All right, we'll see you in the next video.